And here we go. So let's get started. Okay, so just wonderful. Thank you, everyone. Welcome. Welcome to the webinar, Lung Health, Reversing Inflammation Naturally. I am Dr. Dawn Siglain here. I am happy to be with you all today. I'm a naturopathic doctor, as well as licensed acupuncturist and Reiki practitioner. So I thank you for joining today. I know that we have a couple more minutes. So I just wanted to make sure that we were all set here. And it looks like that we are. Okay, I'll give a few more minutes for everybody to tune in today. If anyone has any questions, feel free to ask them. I will get to as many of them after this webinar. And if I can't, feel free to email me. My information is going to be at the end. It is drdawn, D-A-W-N, at innersourcehealth.com is where you can email me if you have any specific questions that I might not have been able to get to during this webinar. But there's a lot of information. If you, and Melinda, we are going to be talking about NAC. I have it right here. So you're one step ahead of me. NAC is very important, and I'm going to share why during the webinar. So everyone just hang tight. There's going to be a lot of information. If you were on this last week, it is going to be most of the same information. So, you know, but of course, every time is always a little bit different. Something comes to mind and I end up sharing that. So all right. So let's get started. I think we've got a good crew here. We're on Instagram, Facebook, and we've got the webinar, everyone that we've reached here. Amazing. Okay, great. And I have some great questions coming in. So I think a lot of these questions too, they're going to get answered in the webinar. So again, sit tight and I hope that you enjoy. Okay. So welcome to the webinar here, Lung Health, Reversing Inflammation Naturally. So I'm really excited to share with you today. Okay. Here we go. Great. So I am, anyone who's new and meeting me, welcome. I'm a naturopathic doctor. I graduated from the University of Bridgeport and I am board certified and licensed in Connecticut. I practice in New York State. I'm also an acupuncturist where I received my master's at University of Bridgeport as well. And I hold my New York State license with my master's of acupuncture. I'm also a Reiki practitioner and I got trained as a NASM personal trainer. And I also started on this health journey as a health coach. So I'm really grateful for all the knowledge that I've accumulated in all different ways throughout the year. So when it comes to lung health, I want this to be one of the main points that comes home. I hope that everyone understands that naturopathic medicine is extremely effective. There are so many things that you can do, and I urge you to start doing them right now. And we're going to get into that. So when it comes to naturopathic medicine, food is medicine first and foremost with nutrition. There's so many food choices that I encourage you to eat, as well as some things to avoid that can really benefit you. Making proper lifestyle choices that benefit your health overall, as well as, you know, particularly with our lungs. And supplements, so proper supplementation being really important here, making sure that you're taking quality supplements as well as supplements that you actually need. Less is more when it comes to supplements for the most part. And I also love to work with daily affirmations. So I'm going to talk about how important that is in my practice and how that also benefits my patients with healing and can benefit you as well. And I'm going to talk about my own journey with pulmonary health. So I might use these terms interchangeably. Lungs and pulmonary health, they both mean the lungs. So I had mild obstructive lung disease and I reversed it naturally using naturopathic medicine. So very grateful for going to my pulmonologist that helped me diagnose it, but he wasn't the one who was going to bring my body back to balance. That's where naturopathic medicine came in, and the naturopathic doctors that I consulted with that. So you have to know who you're asking to for help, and be realistic about what you expect, how they are going to help you. So sometimes you have to ask a few people, you know, to get what you want. And that's what I'm here to share, that a naturopathic doctor could help you on this path. And it really is a doctor for you to consider. They're all over the country. If you are not in New York, again, we are doing telehealth, so doctors you're able to reach them now. over video conferencing, just like a media like this is. But if you're looking for someone local, and once this is all said and done and you want to meet someone in person, please reach out to me. I can guide you to how you can find somebody in your area. Okay. Should you start lung support now? This is a common question that I get, and absolutely 100% with a resounding yes, you should, because you don't want to wait until you have trouble breathing. That's nonsense. That's not the time to take action. I always say that the body talks to you in 3 ways. It whispers to you, it talks to you, and then it starts screaming at you. In my situation, I took action right when it was pretty much talking to me. It was kind of teeter-tottering on whispering to me. And I took action. Don't wait until it's screaming at you. You're going to be in a lot of pain. And then that's when, perhaps naturopathic medicine might not even be an option for you. And you really don't want to be in that sort of situation. You do want to have some natural remedies, ways that you can help support yourself. So when you listen early enough, when the body's more in balance, you're able to be in tune with when the body is out of balance, and then you can take action to help yourself. So the time is now, but pick what works for you. So I'm going to be giving a lot of information today. So please pick what works for you. If you see something that I've said and you go, no, not my style, then it's not for you. And that's the beauty of naturopathic medicine, is that we have so many tools in our toolbox that I'm constantly checking in with patients saying, does this work for you? Because if that doesn't work for you, I've got something else. I've got another option for you. So you don't have to be doing everything that I'm talking about today. I think you're going to gather from this, there's going to be some points that I'm going to stress that are really important for you to take into serious consideration for yourself, but you don't have to do all of them. You don't have to do all of them in one day. It's all about doing this slowly over time. Change takes time. Be gentle on yourself, and try and at least experiment with these options that I'm giving you today to help to support your lung health and your respiratory health and overall optimal health. And preventative medicine, which is what naturopathic medicine is your best defense. So then there's a lot of information about the lungs. So everyone's talking about the lungs, but there's, we really have to understand this precious, delicate organ that we have. So here's a lovely x-ray depicting both the right and the left there, are indicating the right lobe. So the left lobe, so they're actually different sizes and shapes. Some people, this might be new information. The left one is comprised of 2 lobes, and it's smaller and has an indentation for the heart, right? Makes sense. The right one has 3 lobes. It is shorter for that organ everyone's always detoxing, right? The liver. 3 major functions of the lungs. So it helps us to breathe and talk, right? When someone is suffering, needing oxygen, they're having trouble breathing, and they also can't communicate, which can be really tough, because if you're sitting there suffering, and let's say you don't have a chalkboard, you don't have something to write it on, and they're asking you, and it could be a very dire situation, and you can't even communicate how you're feeling, that's a really tough situation to be in. So I hope people take this information to heart, that there's a lot that you can do to take action now to help to support you. The lungs also helps to maintain proper pH. So I know a lot of people, we're always talking about pH. Support your lungs, support their proper pH, right? We're a balance of acidic environments and alkaline environments. Supporting the cardiovascular system. So when you have shortness of breath, that's a matter that you need to find out where the imbalance is in the body. I'm going to talk about my situation here. You want to see 2 doctors. You want to see a cardiologist for your heart and a pulmonologist for your lungs. I'll talk about that a little bit more. And these preventative measures do keep the lungs healthy. Doing these things every day, doing a little something each day for the lungs is important. So the lungs are there for our gas exchange. We know this. It delivers oxygen to our bloodstream. Then the heart pumps the blood throughout the body, and oxygen gets delivered to the cells. Essential. We need this. We need to have this free flow of qi. I'm going to be talking about it to make this happen. The lungs, so important. And all of the organs are important, right? But particularly, when any organ dysfunctions, you're going to be suffering. So I'm going to talk about with the lungs here, we need oxygen, which is what the lungs are able to supply to us. We need food, and we also need water to create energy. So we need this oxygen for our energy source. And the oxygen has to be brought from the outside air, as we know, into us, into each of our cells. So think about that. That is naturopathic medicine at its finest. Nature to nurture ourselves, nature cure. And think about, we're taking the outside air and we're injecting it into our bodies. You know what they always say, that the world is inside of you. You know, your perspective is everything. And think about that when you have your lung qi and you're getting all the oxygen and you're injecting it into all your cells, you're giving the cells what it needs. Now you have this energy. It's a beautiful moment. So every moment we are connecting with this beautiful world, putting it inside of us, giving us what we need. It's a real beautiful moment. Think about it. Our lungs, you know, our first breath, it brings us into this world. And it's the last thing that we do in this physical world. So it really is a beautiful thing. And proper breathing, deep breathing is so important. So not doing shallow breathing where then you're tensing up your muscles and you're tensing up your neck and your trapezius and your upper back. You're bringing the lung qi all the way down into your belly. So when you do this breathing technique, you can hold your hands on your chest and your hands on your belly. And when you breathe in, make sure your belly is the one expanding your belly and that your chest isn't moving. So when your hands are like that, you can see if your hand is moving up and down, but you want that hand to be still because you want to be bringing the air into the belly. And then when you exhale, it leaves the belly. So for all listening, if you want to practice that during it, that would be a really good while we're listening, because we can always use our body as a tool to support us. When you know what your body needs, you can use your body to support us. So I am, you know, it was, my situation was unique. So I had something called mild obstructive lung disease that I didn't find out until a few years ago. And looking back on it, there were issues with my lungs that people had been telling me, and I just wasn't taking seriously. So it was very interesting. What had happened to me is I was on the treadmill. I was just doing something called these Orange Theory fitness classes, if anyone's been to them. And they put the treadmill on these really high inclines, you know, and then you just, you know, run to your heart's desire. Really strenuous workouts, fantastic workouts, I have to say. So I was on the treadmill going really, really fast on the incline. And I remember it was a cold winter day. It was in the beginning of March, I believe. And I got this cold sensation that came straight into my sternum. I'll never forget it. And it knocked the wind out of me. And the sternum, and it was right here. And I felt this cold sensation and this tightness. And it was so uncomfortable. I remember I just kept rubbing. I just wanted to move some energy. I felt a stuckness and I wanted to warm it up because it felt so cold. I had to get off the treadmill. Again, this happened within seconds of my workout. I lowered the incline, stopped the machine, and I had to think, what the heck just happened to me? I couldn't figure it out. And so the shortness of breath lasted for 2 days. I was pretty uncomfortable. It wasn't as bad as the initial incident, but it was still pretty uncomfortable. But by the time I got to the doctor, it had already passed. So I went to the cardiologist first for a heart. Again, my cardiologist said, "Oh, but you're young, you're healthy. I don't think there's anything wrong." I said, "Well, could we please do a full workup?" So I had to beg the cardiologist for a full workup. He was convinced that there was nothing wrong with me. And then I came back and he's like, "See, you're fine." And my heart was fine. So then I made my second stop to the pulmonologist. By this time, it had been even longer since I had had my incident with shortness of breath. And remember, it lasted for 2 days, the shortness of breath. Not okay. That's definitely a sign. You don't want shortness of breath lasting that long. That definitely was an indication that there was an imbalance in my body. There was something off and I had to figure it out. Again, the pulmonologist tells me, "Oh, your lungs sound clear. You know, I think that you're fine. But would you like a pulmonary function test?" And I said, "Yes, of course. Yes. Let's get more testing. More testing is more information." Okay, so you want to rule in and out things. So it was important that I got this pulmonary function test because now this was going to tell me how my lungs were functioning. And I remember I took this test. If anyone's had a pulmonary function test, feel free to chime in here. I had so much trouble doing it. And I thought that the machine was broken. I'll never forget. I go to the lady and I said, I don't know. Your oxygen tank is devoid of oxygen. Something's wrong here. She's checking everything. She goes, no, everything's fine. So it took a very long time. I remember it was about 45 minutes. And then I left and I said, "Oh, there must have been something wrong with that machine." Lo and behold, the pulmonologist calls me up to tell me I had mild obstructive lung disease. I said, "Well, what does this mean?" He said, "Well, it's most likely going to turn into COPD and there's nothing that you can do about it. All you can do is monitor it every year and hope that it doesn't progress." That was not the answer that I wanted because I knew that there was a treatment that reversed obstructive lung disease called inhaled glutathione. So I asked him if he would help me with this treatment? And he said, no. I said, well, would you give me a script for a nebulizer? He said, no. So I said, well, thank you for the test. And I went on my way. So I got the nebulizer on my own. I went to other doctors who could help me, who gave me the prescription for inhaled glutathione. And I got it from a pharmacy that was a sterile compound pharmacy. And it's indicated for my condition. So it is not indicated, and I'm going to talk about this now also. So again, I had mild obstructive lung disease, just to go over this PowerPoint that I have here. I had the shortness of breath for 2 days. I did have a chronic cough. So I remembered I had a friend of mine who said, you're always coughing. And this was years ago. Over 10 years ago. And I said, that's weird. I didn't notice that I had a cough. I must have just been so used to things. That's the thing, is that you kind of always need a different perspective. Ask people if you think something's wrong. Ask people if they were noticing anything with you. Your loved ones, they typically know stuff. They might not think that it's appropriate to tell you, or they don't know what to make of it, but have these open conversations. So I had a friend tell me that, and I remembered I just dismissed that years ago because I didn't have anything else to go by. I didn't know to go to a pulmonologist. And I wasn't feeling any other symptoms. So, but I never forgot it. It was always in the back of my head. And I remember whenever I'd be exposed to cigarette smoke, if I went to the casino with my friends, if there was ever smoke anywhere, I would be the one really reacting, and I couldn't breathe, and it would always affect my breathing. I'd always ask my friends and go, isn't that affecting you? Aren't you affected by this smoke? No one was as affected as I always was. I was always really affected. And then I always had this redness in my chest and my neck. This is almost every day, people telling me, oh, you're so red, you're so red. And I just started dismissing that also because I didn't have anything to go by. I would just be sitting there and people would say, why is your chest so red? And I didn't have an answer for them. Once this treatment started, and then this all happened, all of that lessens. So not one person's even commented me about that since then. So I thought that was really interesting. So what I did, it was this treatment called inhaled, or it's also referred to as nebulized glutathione. It is indicated for obstructive lung disease. However, with everything that's going on, if someone has obstructive lung disease now, with the threat of coronavirus, it's an aerosol that goes out into the air. So unfortunately, this is not a treatment currently that they're even able to use, which is so unfortunate, because if someone has COPD, if someone has obstructive lung disease, and there's a variety of them, this potentially could be a treatment that could help them, but because it's a part of a nebulizer and then aerosols into the air and could spread the virus, it is not being used, which is another reason as to why you always want to have your health under control. You want to have any chronic conditions really under control at any time, because this is a dire time now where you could have, if you had obstructive lung disease, you could have reversed it, similar to what I've done. But during these circumstances now in the hospital, they will not be able to give this treatment to you, which is unfortunate. I think that it's really sad. But 2020 hindsight, right? I'm very grateful that I did this years ago for myself. So contraindications to inhaled glutathione, it is contraindicated, which means it should not be used for patients who have asthma. It is because it causes this bronchial spasming and constriction, which would be a very dangerous situation. So you don't want to use it for that. But if anyone has information about it, has had an experience, please let me know. If anyone knows anybody trying to bring this to the forefront and bring more education to it, I'm happy to talk to people about it. So please do pass my information along, or pass people to me if they want to know more about inhaled glutathione, because I think that it's very important. More pulmonologists should know about it, should be using it for people who have obstructive lung disease. So again, shortness of breath, can't stress this enough. Go to 2 doctors for workups. Go to your cardiologist, make sure your heart's doing okay, and go to your pulmonologist and make sure your lungs okay. Can't hurt to go to both. Even if, let's say, the cardiologist finds something, just get a checkup at the pulmonologist and make sure everything's status quo, okay? Very important. You can never, you can never be too careful when it comes to your own health, especially if you got that little voice inside of you that says, I think there's more I need to know. Listen to that little voice. It will guide you. It does. So inflammatory lung conditions. Can have a little sip. I hope everyone has some tea there. Maybe, some nice warm tea is always good to help support the lungs. I'm going to talk about that. So inflammatory lung conditions, there's many factors to consider. So there's infection, there's inflammation, there's accumulation of fluid there. The problem here, we're talking about cellular damage and injury to the cells. So you've probably heard a lot about antioxidant support. And this is where it's important, because with inflammatory lung disease, there's oxidative stress, which decreases the antioxidants. So this is why you might hear people say that you take antioxidant support. But what antioxidant support is right for you? That's what you have to figure out, okay? That's why you should see a doctor who understands antioxidant support and proper supplementation. These antioxidants are a defense against cellular damage. Okay, and I've listed all of these conditions with inflammatory lung conditions. Acute respiratory distress syndrome being one of them, ARDS. Pneumonia, asthma, COPD, which is that, a chronic obstructive pulmonary disease, which is affecting the lungs. Pulmonary fibrosis is another one. Mucus and chronic disease. So I wanted to talk about how important this is and how this contributes to help support the lung health, or could pose a problem when it comes to lung health. So this is a really important topic. Think of mucus as your first line of defense, okay? You want to know that, that you need the mucus, you need it because it's a protective lining, and you just want just enough, okay? Protective lining. So mucus is everywhere. We have it in our nose, our throat, our lungs, as well as our GI tract. So that starts from your mouth all the way to your anus. That's your full GI tract. You want proper amounts of mucus there. There's antibodies in mucus, there's enzymes, there's protein. An excess amount of mucus is produced in response to infection and inflammation. So this is what we're talking about. So if there's any inflammation in the body, and it's important to talk to your doctor and get your inflammatory markers tested. Very, very important. So then you'll know if you have any inflammation in the body. And where is it? There are so many inflammatory markers to test. It's important to test for a bunch of them. Find a doctor who's going to test all of these different inflammatory markers to get you the answers that you want. Okay, you can't just test one inflammatory marker and call it a day. There's so many ways to assess inflammation in the body. Find a doctor who knows how to do that. It's really important. And then this chronic mucus, this buildup of it leads to the inflammation. So we want perfect balance in the body, which is called homeostasis. So that's what we want. So mucus, this is not the bad guy. We need it. Phlegm is a type of mucus that's produced in the chest, in our lungs, in our lower respiratory tract. And it's important. So phlegm isn't the bad guy here, right? This is where it exists. It exists in the lungs and in the lower respiratory tract. It traps inhaled toxins to clear them out, keeps the airways moist, right? So we want the airways moist. We don't want them too dry, and we don't want overproduction there of the mucus. And this phlegm, its response is it's responding again to inflammation or infection. So inflammation is a real culprit here, as well as infection. And the problem is when it thickens, because now it's blocking the airways. So this is a huge problem. And I listed all the different colors of phlegm here. You guys can refer to the PowerPoint again to see this. There's always exceptions to this, so don't diagnose yourself. Go see your doctor, okay? There's all reasons for whether it goes from clear, green and yellow, brown and rusty, white, black, or red and pink, okay? Important to know what it is. So when you go to your doctor, you can tell them this. On my PowerPoint, I give a lot of information for you to guide you. But again, always see your doctor for a diagnosis. Do not try and self-diagnose yourself and cause any panic. That's the last thing you want to do. So when it comes to congestion, listen to yourself. Pay attention. This is your body whispering to you, okay? And it might be talking to you if it's been going on for a long time. So I get these questions all the time. Well, is it okay if I just wake up with congestion? Is it okay if I just get a little congestion? Congestion, figure out why it's settling in. Is it settling in because there's mold? Is it settling in at night because it's dusty in your bedroom, or you have an old mattress that maybe you need to replace, or maybe you're not changing your bed sheets as frequently? Why are you getting the congestion, during the night? Sometimes just by settling and sleeping that way, you get it. But understand that what I'm about to tell you, there are ways that you can decrease the amount of congestion, decrease that overproduction of the mucus. Again, being congested is a sign your body's whispering to you. There could be inflammation going on the body. Decrease this inflammation, you're going to decrease the mucus, therefore decrease the congestion, okay? It's definitely worth exploring and figuring it out. Sign of this dysfunction in your body, right? In Chinese medicine, So this is why I love with acupuncture, because I look at the tongue and the pulse and it gives me so much information. I get so excited about this. You know, I know my fellow acupuncturists out there, they're like, yeah, tongue and pulse diagnosis, because the tongue is the one muscle in the body that we can see. And it gives us such good information internally with the organs, because all of the organs are connected with our tongue. So in the front, we have the heart. Right behind there is the lungs. On the side is the liver and gallbladder. Behind the lungs, right in the center, is the stomach and spleen, which has to do with digestion. And then we've got the kidney and bladder, then that's further in the back. So really cool information. The way that the tongue presents, the coat, certain conditions that the tongue might present with. There might be something on the side we call scalloping in it, the color, even underneath, there are these veins underneath that we look for that might show something called qi stagnation or blood stagnation. Super important. So find someone who knows how to analyze it, and they'll give you a lot of information that will help you. But with Chinese medicine, when it comes to congestion, they're thinking could it be damp? Could it be excess? Could it be heat? Could it be cold? So they get it. They understand that you know, a lung condition is not, it's not just one thing. It could be a variety of things. So damp is one presentation, excess is another. If it's heat, it's cold. And then it might also go through different stages to also show these. So it's pretty cool to understand the root cause, which is what naturopathic medicine does. So we look at it in different ways also, because, you know, a headache's not a headache. You know, you can't just take a pill for a headache. Could it be a dull headache? Could it be a pounding headache from an excess condition? There's reasons for it. You know, do you have, is it a damp headache? Like you get these headaches right when the weather gets bad. A headache's not a headache. Just like with all this is individualized medicine. It's really important to understand your specific condition so that you can reverse it, reverse the chronic disease, reverse the chronic inflammation. Okay, but also take charge of your lung health, because you can do all these things to support your lungs before you're out of breath or you have shortness of breath. Okay, so all these reasons as to why it's congested: any pollutants, any toxins, dust, and mold. Cigarette smoke. There's secondhand, and then there's also third-hand smoke. So now they're trying to figure out why people are having lung cancer or lung conditions, and they haven't even smoked. They're not even around someone who does smoke. Third-hand smoke is if you're hanging out with someone who does smoke and it's on their clothes, or perhaps it's in a home where someone smoked and now it's in the rugs, it's in the walls, it's on surfaces that people used to be smoking in, and then you're now working in that office space or living in that home, and now you're having a lung condition because you're exposed to this third-hand smoke. Something else, right? So you really got to take care of yourself, understand your current situation, what could be causing what's going on with you, and food choices. So there's some inflammatory food. So can anyone guess what I'm about to go off on right now? The number one reason for congestion. So there's no useful purpose for humans, but it's everywhere, and it's extremely inflammatory. It's extremely addictive. And when it comes to heaviness and dampness in Chinese medicine, it affects the tissues and it affects our joints incredibly. Can anyone guess? Can anyone guess? Yes, this webinar will be posted. It will be posted on YouTube on Inner Source Health. Yes, Emily wins it for the day. Dairy, there it is. I was waiting for someone to say it. So congratulations. So no animals consume it past infancy, except for humans that have this brain capacity to think, you know, that and realize that this is not good for us. Why the heck are we doing this? There's a money-making industry in here, people. There's greed. It's not good for you. Dairy is not good for you. Why are we consuming another animal's milk? So it's for a calf to become a 400-pound cow. I have yet, and I know it is not going to happen, so I say this facetiously, to have a patient walk into my office and say, hey, doc, I would like to be a 400-pound cow grazing in a field, just nibbling on grass all day. Hasn't happened. It's not going to happen. You should not be having dairy. And it's a major contributor to this congestion, to this mucus, to this buildup, which is an inflammatory situation. And it is the root cause, this inflammation, in general, root cause of most chronic disease. Okay. And it's not helping during this time. Anyone, you know, with this coronavirus, with everything going on, you don't want a chronic condition to start with. Okay, so you really want to understand if there's a chronic disease to reverse it. Naturopathic medicine does reverse it. I've had 2 experiences with it. Anyone tuning in now, you can listen back to when I was talking about my mild obstructive lung disease. It's bad news, guys. You don't want chronic disease. You want to stop it, because once you open the gateways and you have one chronic condition, it's a breeding ground for all the rest of them. You don't want it. And I've been through it. I had a whole bunch of them: IBS, autoimmune condition, the pulmonary issue. But you can reverse it and you can feel a heck of a ton better. So this dairy consumption early in life is also linked with asthma, a major lung condition that people suffer from, hay fever, rhinitis, respiratory tract infections. Okay. And there needs to be understanding, though, why are we craving dairy? It attaches to opioid receptors, something else, right? So there's pain relief. So something called casein in it, it's the protein in dairy. It's triggering the brain's opioid receptors, and it releases these opiates that are connected with it. Food for thought. So when you think about that, then you have to think about, the pain. So I'm going to talk about that a little bit more. So hang tight there. But breast milk versus cow's milk. I hope everyone's liking my little pictures on the PowerPoint here on Instagram. You guys aren't able to see it. But if you did register for it, you can see my PowerPoint. It'll be on YouTube later also. So the benefits of breast milk are very important for our little infants. It's nutrient dense. Colostrum in it is rich in antibodies. It promotes this epithelial barrier functioning, which is a protection. Okay, so the epithelial lining, which is in our gut, which is throughout our body, we want it functioning just right. And there's growth factors that facilitate gut maturation. So you want that when you're an infant, right? You're growing and building. We don't want these growth factors when we're an adult. We're trying to maintain, right? No one's trying to become a 400-pound cow. And if you are, then we need to have another conversation, right? But you don't want these growth factors as an adult. And there's growth factors. It's not just in dairy. Think about the whole agricultural business. Why are people getting larger? Why are there so many weight issues? People want to lose weight. When you think about growth, growth, benign and malignant growth also, what's this coming from? Growth factors, okay? So dairy has that in it. Major bad guy, right? Bad news bear. You don't need dairy. And there's no evidence supporting that cow's milk. And this is just not cow's milk. I'm talking about sheep and dairy, all the dairy, guys, okay? None that it supports that epithelial barrier functioning in humans past the infancy, right? This epithelial lining is really important that it's intact, and it gets disrupted by inflammation, allergens, and infection. And now back to that pain relief, right? So that was really interesting. I hope that that was interesting information. Dr. Christian Gonzalez actually had talked about it on his Instagram, Dr. G. So giving you a shout out. And that's where I heard about it. And I thought that was very interesting. So these opiates, there's pain relief, and it's addictive, and it has a calming effect. So this is why dairy is so attractive to us. This is why we like it. But you have to ask yourself, do you have pain? Is it physical? Oh, it's in my elbow. It's in my knee. Or is it emotional? Eating dairy provides this quick relief, but over time it causes chronic pain actually. So it's a real issue. And as human, you sit there, you go, but I love it, but I want it. It's not helping you. It's not helping you if you have a chronic condition. You're not going to feel better with the dairy. Okay. It's a momentary fix, but it's actually going to make your pain worse. It increases the inflammation. You're going to have more chronic disease. You're not going to be better in the long run. Okay. So I hope that makes a lot of sense to everybody. And there's a wonderful world there of avoiding dairy. I talk about this all the time. I post about it. Okay. I'm constantly posting healthy food options because this is so important. And all these nutritious alternatives are out there. And feel free to share with me. I'm also learning from patients. One of my patients had shared some stuff with me. So, I'm happy to share with you guys. So these plant milks, okay, nut milk, oat milk, all these, or they even have creamers, to use those in your tea or coffee. There's something called a pili nut yogurt. I'll give a shout out to Lava. If anyone's had these are really delicious. My little nephew, Braden, who's over a year old. Hi, Taryn, loves it. In fact, he gets so excited in this little Fico, and he gets so excited in his high chair, and he just eats this stuff up. So I actually like the original flavor, unflavored, but there's strawberry, raspberry, vanilla. There's a bunch of different delicious flavors. It's really good, and it's full of prebiotics. And there's no sugar added. That's why I love it so much. Nut cream cheese. I've had that. I made a cauliflower crust, anti-inflammatory, dairy-free, gluten-free pizza with a nut cream cheese. It was so delicious. And all of these cheeses also, I found a smoked Gouda that didn't have potato starch. So I have to do different anti-inflammatory things for myself. And it was really delicious. So some aren't, you know, so I've had to pick and choose. So if anyone really wants to pick my brain, I'm happy to share with you. Health benefits. So you're avoiding dairy, the congestion clears, energy comes back, right? Because when you have congestion, then there's this dampness and this heaviness. You don't have any energy. You don't feel good when that's happening. And asthma comes under control. Suddenly people aren't having these episodes that like they used to do. And the pain goes away. It's really cool. So nutrition. So there's tons of foods that you can eat, you know, and I'm going to talk about them here. So, and I have this picture. These are the Asian pears that I have here. So just a side note, you see those little numbers that are listed here? Anything that starts with a 4 and is 4 digits is not organic, but if it starts with a 9 and it's 5 digits, it is organic. So these are these Asian pears that I love to talk about. And when you boil the water, bring the water down, put the pears in them for a few minutes, and then get the pears nice and soft. It really helps to decrease congestion. Time and time again, it works. I love it for myself. If you can't find an Asian pear, you can use a regular pear also. But there's tons of vitamin C and K in it. It dissolves and breaks up this mucus. There's tons of good fiber, and it's tons of antioxidants in it also that we need. So avoid gluten and sugar as well as dairy because they are all inflammatory. Okay, and I get this a lot. People say, oh, but I don't have celiac. I don't have a problem with gluten. Not true. The way that wheat is processed in America is inflammatory. There's too many chemicals and pesticides with it. It's inflammatory. The protein in it, gliadin, really causes disruption in the body. And if you have inflammation already, you're just putting even more fuel on the fire because when it's inflammatory, so you need a gut lining that's strong like this, right? And then all the food can pass through it. If you have inflammation, which if you have these inflammatory foods, it makes it worse. If you're on the brink of inflammation, what happens is that these foods that are inflammatory, and even something like stress is inflammatory, right? So if you're stressed out, plus you're eating these foods, well, you're in for quite a bad treat. You get these little pockets. You see that come in. So instead of it being tight like this, now suddenly you're getting these holes, and then this little other finger coming through. I'm not sure if the angles are coming out through here, but then what happens is that the proteins in this food, so this thumb guy here, comes out of these tight gap junctions, and now the proteins in your bloodstream causing inflammation. Not what you want, not what you need. Inflammation can come from a variety of sources, again, but you eat these inflammatory foods, it makes it worse. Okay. Then we have something called doctrine of signatures. So it's where the shape and colors of food help to support the organ. So the color white in Chinese medicine is the color of the lung organ. So when you think of foods that are white, they help to support the lungs. But garlic's one of my favorite ones because look, think of the shape of it. Those are like all little lungs hanging together, right? And it's white, so perfect. You eat that, it's so many antiviral, antibacterial, perfect lung support. Have it raw, chop it up and dice it up. It has the medicinal property in it is called allicin. And when you eat that, when it's raw, you get the most benefit from it. White onions, lychee, dragon fruit. I love that. Has anyone had that? If anyone wants to chime in, I think it's so delicious and it's so hydrating, and you just cut it in half. It's this pink fruit with all these spikes on it. It actually looks either cool or scary depending on how you feel about it. And it's also called pitaya, if you've seen that. And you chop up this jackfruit and then you just eat 2 sides of it. You could share it with a friend. I think it's like a nice, healthy gelato. I think it's wonderful. Or in jackfruit also, that's another type of fruit. So any of these white foods, veggies, you know, try and think of veggies or fruits, can help to support you. So when you think of, you know, fiber in fruits and veggies, so veggies are full of fiber, but then they also have all those macronutrients. Veggies have plenty of protein, carbs, and good fats that you need, right? And then fruits have all the fiber too, but then they have the sugar. So you got to think if that's what you need or not what you need. Foods rich in vitamin C are going to help to support the lungs. Again, antioxidants and flavonoids. So when you think of colorful foods, so now we think of the white foods, right, to support the lungs, but then also we need antioxidants and flavonoid support to support the lungs. So we're talking about eating the rainbow here, folks, right? And try and do it daily if you can, ideally. If you can't do it daily, then at least weekly. You know, get all the colors of the rainbow in, because there's your antioxidant support. Super important. And I'm a big fan of food as medicine, always looking at food first, having a big list for my patients there. Supplements, the last one on the list, just if that's what you need, right? Good fats, omega-3s decrease the inflammation, okay? So tons of ways that you can get these from foods. So ground flax seeds, if you get those, store them in the fridge. Chia seeds, hemp seeds, seaweed, huge, right? Where do the fish get their omega-3s from? They're eating the algae and the seaweed. Walnuts, and tons of herbs like thyme, oregano, sage, and peppermint, right? They're all really great. And our cells are thirsty, so I'm going to take a nice big sip of my water, and I encourage you guys to also. And our lungs are mostly water. Our cells are thirsty, they need it. So water helps to keep these airways clear of mucus and clear of this inflammatory buildup, okay? So it loosens it up and it moves the lymphatic system. So what also moves the lymphatic system? Exercise. Our muscles move the lymphatic system. Our lymph is just ever so slightly, if you touch, there's our lymphatic system, right? Lymphatic massage is very different than getting something like a deep tissue massage. So don't forget your lymphatic system. I always say it's a forgotten system, and it's so important because that's where toxins build up, right? Our immune response is in there when our lymph nodes get hardened or thickened, or they're tender. So warm water with lemon is really great, okay? And especially warm, why? Because it improves circulation, it expands the arteries and veins, and it carries the blood more efficiently throughout the body, which is just what we need, okay? And think of things that are warm. So ginger and cinnamon are warming. So even like having a warm tea in general, that warmth, but then you also think herbs that are warm, that are gonna help to support your system too. If you want it warm, ginger and cinnamon. Peppermint is actually cooling. So the whole peppermint family is cooling. So, you know, it depends. If you are, you know, tend to run really hot and you're feeling hot that day, you might want to have a hot tea, but might be peppermint, you know, it could cool you down a little bit. But ginger and cinnamon are warming. So those are some good options to have if you like that. And so I love what she said. If anyone's been watching, Dr. Deborah Birx, and she said this a couple weeks ago, during this pandemic that we're encountering, is that it's all about behavior changes. And I loved when she said that, because our lifestyle changes, this is the second big topic that I give my patients when they give a full sheet of their health plan. And this is where lifestyle changes come in. Making healthy habits, things that you can do every day to support yourself, really important. And I want to take a moment to talk about the mindset, because, you know, I turn on the news just to check in every day. I typically don't like to watch it, but I am, you know, I just feel like it's important to be informed. You got to pick and choose who you're listening to, what you're believing. But they said something the other day, you know, and they played this like really daunting music, that it's a war. And it's not a war, because that implies that there's a winner and a loser. And let's face it, viruses have been here since the beginning of the time. They're not going anywhere. And in fact, they're replicating faster and faster than we can even try and fight them. So it's not a war. There's no fight going on. You know, we have to look within ourselves and figure out, how do we be our best selves? How do we support our immune system? How do we support our lung functioning? And that's by making the right choices. Okay, trying to get any inflammation, any chronic disease reversed, being in the best state of health that you can always be in, because you don't want to be in bad health when a pandemic arises. And if it is, you're going to need that extra help. And the least amount of people that are suffering, then the more help that can be out there for the people who really need it. So, you know, being your healthiest self is a really good for yourself and others, taking care of yourself. And this fear mongering is crazy, but it can do two things to you. It can motivate you, or it can paralyze you. So I urge you, if you're watching the news and you're hearing all this fear, use it to motivate you to make better changes. Now's the time to act. Think about naturopathic medicine. Consider the things that I'm saying today and take it to heart. And make the changes to make yourself healthy, and then use this pandemic for your favor to be the best self that you can be in health, in mind, body, and spirit. Okay, and change takes time, so be gentle on yourself. These, like I was saying, all these things I'm sharing with you, don't try and do it overnight, but maybe try something once a week. You know, make note of what might work for you. And these healthy habits, again, they have to start now. So anyone watching my PowerPoint, this is a picture in the Montauk Salt Cave. So I do talks at the Salt Cave, which is in Huntington. So there's the first one originated in Montauk. I do talks in Huntington, and then there's one in Manhattan. And look at how relaxed this is. So those are called zero gravity chairs, and you just lay back in them, and everyone's just meditating while I'm doing my meditation wellness talk in there. There's my singing sound bowl to the left, and it's really just lovely. It's so wonderful. And then they infuse the Himalayan sea salts in there. It is an anti-inflammatory environment out there when you're breathing in these Himalayan sea salts vapor. It's an antibacterial, antiviral, antifungal. It's antimicrobial amazingness in there, and you feel so relaxed. You feel energized. You feel relaxed and energized at the same time. It is just the most amazing feeling, and you're ready to take on the day. So I do these, you know, midday every other Wednesday, and I absolutely love it. And they're having a wonderful sale now this month. $100 for 10 sessions. So that means each session is only $10 when everything's up and running again, when it's normally 40. So, and the days that I do it is half off, where it's $20 each. So if you're interested in a Himalayan sea salt, they're all over the place. There's probably one by you. I encourage you, go to it. They're amazing for so many reasons, but particularly for lung health. And that's why I included this picture here. It's really fantastic. So eating, sleeping, and excreting, okay? As it comes to naturopathic doctors, I'm asking these questions, okay? I want to know where you're eating. I want to know what you're sleeping. And are things coming out? Are you urinating and pooing the way you want? And what does it look like, okay? And how does that work for you? It all matters. And you want to make sure that all of them are happening in accordance with you and your health. Hot steams can be really helpful too. So doing a steam, you can stand over. I prefer doing a nice steam shower. I think that's really wonderful, and it's easy to do. And if you're feeling sick, if anyone's sick or congested, take a few hot showers, like really hot steamy showers. Cover your hair. You know, you don't have to be washing your hair each time, and take a few of them each during the day, like 2 or 3 at least, because it's really going to clear that congestion. And when you're acutely sick and you want to loosen that up, the hot steam really does that for you. You can also do it, you know, you can boil a pot of water, bring it down, make sure that you are healthy, and you can stand over this with a towel over your head and let that steam just rise up, and that can clear you also. You know, so whatever works for you. And now I'll even in the shower, I have my essential oils in there, and just breathe that in with the steam. It's really wonderful. Doing a nasal rinse or a neti pot, if that works for you. I know some people who just don't like that. So again, if it works for you, that's really great. And the wet sock treatment, I love talking about this. So wet sock treatment is, I learned about this on my first day in naturopathic medical school. So I've been using this for many, many years. And it's great for decreasing congestion. It's great for boosting your immune system. You do it right before you go to bed at night if you want to take a nice warm shower. And this is a form of something called hydrotherapy. It's very effective. It also decreases a fever naturally. So fever, you don't necessarily want to just decrease it and take things to suppress it, but this wet sock treatment does it naturally. So if you're sick, do this wet sock treatment at three nights in a row. Even if you just do one night and feel relief from it, good for you. You could just simply wipe your feet if you want, or take a shower before bedtime, and then get cold socks. You can run them under cold water, just cotton socks that go up to your ankles. And run them under really cold water and rinse them out. You could also put them in the freezer if you want. Some people do that, or they have a bucket of ice and they put it in. Whatever it is, it can be as cold as it wants. But you want to wring it out. You don't want it dripping wet. So you wring out the water, you put the cold socks on. It's so cold. It's so cold, but it feels so good. And then you put warm wool socks or wool blends that comes up past the ankle. So it might be like shin length or something like that, or even knee high. Any warm socks right over that are dry, and you go to bed. Or, you know, we call this magic socks for the kids. They love it. It's wonderful. It's going to decrease that congestion. It brings mucus down. What it does is also instilling that homeostasis. So your feet are really cold and your body's doing everything to increase circulation so that your feet become warm again. That's called homeostasis, bringing the body back into balance. That's what it's doing. The pull socks. So I have this guy here. So you put it on your finger. Some of them work better if you don't have nail polish. And it's going to tell you your oxygen level as well as your pulse rate, which is really great and handy to know. This is really cheap, okay? So it's called a pulse ox. You can get this online. You can get it at your CVS or Walgreens. Have it handy, okay? Very affordable to have at home. Know what your normal oxygen level should be. Anything above 95 is normal range. If it's below that, see your pulmonologist, see your doctor, find out what's normal for you if you do have a condition, okay? And this is important to know because then when you call your doctor, if you're not feeling well, you can call them and this is called a pulse ox. So yeah, anyone on Instagram now, you're not seeing the PowerPoint, feel free to go to my link in bio and you can register for this right now. You'll be able to see the PowerPoint. This will also be on YouTube, but it's all on it. But it's called a pulse oximeter. Pulse oximeter, I'm like pointing like that. Or a pulse ox, P-U-L-S-O-X. Okay, pulse oximeter, O-X-I-M-E-T-E-R. Really important to just have on handy so you'll know your level of oxygen there. Humidifier, so if you have dry air, that might benefit your health. But beware if you have any mold or, you know, if there's wetness, you then want a dehumidifier, right? So you want to have a proper balance. So things to consider. Lubricate the nasal passages. So I love this oil. It's an Ayurvedic oil and it's sesame oil in it. It's wonderful. So sesame oil is great for all the doshas, if anyone knows Ayurvedic medicine. And you take it on a Q-tip and you just simply massage it into your the nasal passages there for your mucous membranes. You don't want dry ones because they can't flush out the pathogens or the toxins. So you do want your nasal passages to be lubricated. And sometimes when you're sick, they dry out. So make sure that topically you're moisturizing them. That's going to help to benefit you and flush out toxins. So essential oils, I love them. Where are my essential oils? Oh, my eucalyptus is right here. I love essential oils. So I love diffusing them is great. Using them in the shower, like I was just talking about, you can use them as roll-ons and then you just smell it during the day. Use it right on your chest or your back or the sole of the foot as rubs and put them in a carrier oil. So this carrier oil, because they're very concentrated, these essential oils, the carrier oil will dilute it and it helps it to spread over a large area, which is really important. And deep breathing, okay? So do these deep breathings when you have your essential oil diffuser going. Breathe into the essential oil. It's very grounding for you, okay? And so when you're grounded, you're more relaxed. It helps to enact that parasympathetic nervous system, calms down any stress load, then you can think clearly. And having this deep breathing also, when you're breathing into your belly, like I was talking about before, that helps the lung chi to move where all the places it needs to go to get all the oxygen to all the cells of your body. Really important. And when you inhale and then your exhale, make it a couple seconds longer than your inhale, because that will make you more relaxed. And the more relaxed you can be, the less stress you have, the more you'll be able to have a proper immune response. Your immune system's going to be supported and you'll be able to support your lungs and your whole body in general with your health. So cannot stress how important deep breathing is, and anything you can do to decrease stress is going to help your lungs and your overall health. So acupressure, all the acupuncturists out there. So acupressure is something that you can do at home. It's something that, you know, I like to work through with my patients. So, you know, I'll do a treatment with them and they're with acupressure, but now I can talk patients through it over an appointment. And this is applying pressure on appropriate points, okay? And then also sometimes with just tender points. So when there's pain, I might palpate, and if there's a tender point there, I'm gonna press on that, because pain, something called stagnation, could be the reason for pain. If you simply massage into a point, you're moving the stagnation, you're moving that chi in Chinese medicine, and then therefore you're decreasing the pain. So there's things to think about. Obviously, if there's an injury, you know, but there might be stagnation from an injury too. So there's many ways to approach it to look at this. And there's microsystems. So our ears. So I do, I'll put ear seeds sometimes, or there's specific points, and I'll do acupuncture points in the ears, but you can also just press on the ears. There's a 1-point Shen Men, which is right here. So you can press on that, and that's really relaxing. So you guys can all do that right now. So it's the point, there's kind of like that triangle there in the ear. And so it's right there. You can see where I should have a little pointer. Oh, I have a little pen. So maybe I'll do that, because that's a really, so right there, and you can just press on it. Relaxing, right? And our hands are also another microsystem. So sometimes what I do So there's a lung point here. And when you look at the hands too, you know, different trains of thought that the lung's here, and then I also read a lung could be here. So when I take a deep breath in, and I'll just press on the point, and I tell you, I get deeper breaths in when I press on the points on my thumb here. I just love it. But, you know, it might work different for everyone, but it works for me. So I appreciate any feedback with it. And our feet are also, so that's what I was talking about when you rub essential oils on the feet. And that's really effective for clearing congestion. So rub some eucalyptus and a carrier oil on your feet, but your lungs are connected right there. And it really helps to decrease any mucus and clear congestion. So these microsystems represent our whole body. So all of the bodies in our organ, they're kind of represented on the organs. So all the bodies, so different representations for all of them, but there's these points called lung 1 and 2 that I'm going to talk about. So, and these descend, we call it, and then spread out, disseminate lung qi. So lung 1 is kind of like right here. So lung 2 is up here, and lung 1's kind of below it. Lung 1 calms cough, brings it down, and wheezing. It transforms phlegm, meaning it kind of thins out the mucus and clears heat. Lung 2, which is kind of right up here in a crevice, clears heat and dispels fullness. Okay, so both really important points. Sometimes you can just press on them, feel wherever you're tender, and just press on them, and that might be what you need. And then Qigong exercises for the lungs. So opening up the chest is a great one. So if anyone wants, I could send you a video of this, but it's pretty simple, and it's just opening up the chest. So you can just bend your arms here, and when you inhale, you can kind of have them 90 degrees. And when you inhale, you can have the palms down, be nice and relaxed like that. And then when you exhale, you can have the palms up, you know, and all towards the center. And it clears the lungs from that stagnant qi, and helps to move the qi, and it strengthens the lungs, and it's grounding and enhances breathing. It looks like on Instagram this is going to end, so I'm just going to try and start a new one if that does, but I'm almost done here too. Moving qi with movement. So using exercise, right? So I always say move it or lose it. So there's a blood type specific exercises. So O's really benefit from strength training and intense training. So when you think about it, each blood type, we release our stress hormones differently. So this is where this can really help people if they're stuck with their exercises, what they want to do. A's really benefit from yoga and Pilates. Let's see. I'm going to start, it looked like with Instagram, I'm going to start another one. Okay. So hi everyone on Instagram. I just started the live video now. So we're on part 2 for anyone tuning in right now. So with A's, they really benefit from yoga and Pilates. And with B's, they really benefit from doing things outdoors, hiking, golf, and tennis. And ABs are a mixture with cardio and yoga and weights. So they kind of join with all of them, which are pretty cool. So if anyone's stuck with exercises, they don't know what to do, I encourage you to think about the blood type specific diets and if that can work for you, okay? Supplements, so NAC, so someone was asking about that. Yes, 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 I love my NAC, and why? So it stands for N-acetylcysteine. It is mucolytic, so it breaks up mucus, it's anti-inflammatory, it's a powerful antioxidant, and also helps to detox. I went through, I had heavy metal toxicity, I used NAC to help me detox the heavy metals, very powerful. And it is a precursor to glutathione. So what I was talking about before, inhaled glutathione that reversed my obstructive lung disease, the NAC is a precursor to glutathione. So that's how powerful NAC is. NAC is also something that you can take. Glutathione isn't readily available, bioavailable to the body. So you have to take it in certain forms, where NAC is just in a capsule. It's much cheaper than buying glutathione. And it's really good. I do have a powder here of reduced glutathione that I do take. I put an 1/8 of a teaspoon to 1/4 of a teaspoon in it. It kind of has this purplish look to it, if anyone sees it. And I love it as a little drink. It does have a flavor to it, a taste to it. So it's not for everyone sometimes, you know, what can you do? But glutathione, so it's a tripeptide. So it's cysteine is one of them in it. So that's what's in it, N-acetylcysteine, okay, glycine and glutamate. It's intracellular and extracellular protection of antioxidants in the lungs. So really powerful, and we need it in our lungs to support it. It's what reversed my mild obstructive lung disease, very important. Glutathione is the first line of defense against oxidative stress, and it's in the epithelial lining of the lower respiratory tract, so in our lungs. And this glutathione, it just eats up the free radicals, which is what you want it to do, and it helps to detox, like I was saying. And inflammatory lung disease. So someone just asked me a question about it. So if you want more information about inhaled glutathione, you can look at my other live video. I talked about it. Anyone on Instagram can register for this webinar right now. And you can watch it with the PowerPoint that has all the information in it, as well as it will be on YouTube on our Inner Source Health page. Okay, so this inflammatory lung disease, there's alterations in the lung glutathione metabolism. Super important to know and remember. I encourage anyone, when this is all said and done, or even suffering now, talk to your doctors about inhaled glutathione. If you're having a respiratory issue, if it's obstructive lung disease, to talk to them about it, okay? Test your glutathione levels. You know, ask for these tests. I always say ask, 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 ask. Keep asking until you get the answers that you want, okay? As a naturopathic doctor, I love to answer my questions for my patients and give them as much information about their health that's going to benefit them then, and also for their future. It's, you know, it's important. The more you know, the more you can help yourself. The healthier you are, the more that you can help others. So it makes the world go round, okay? Anti-inflammatory. So there's tons here. I'm just listing a few of them. Again, see your practitioner who specializes in naturopathic health, holistic health, and works with supplements. You want someone who knows what they're doing with supplements. It's really important to be taking quality supplements. Okay, so anti-inflammatory, vitamin D. Oh, numero uno. If you're living here on the East Coast, like I am, and I see so many patients who are deficient in vitamin D. And vitamin D is so important. It's more than a vitamin, it's a hormone. It supports so many of our tissues and our organs and our bodies in so many ways. And it's anti-inflammatory being one of them. We need the proper amount of vitamin D. You don't want to be taking too much. Vitamin D is fat soluble. Too much is toxic in the body. You want just the right amount. So if you're under 60, you want it between 60 to 80. On your labs. If you're under 60, reach out to me, reach out to somebody who knows how to properly prescribe vitamin D3 as a quality supplement to get you to the level that you need. It's really important. Omega-3s, and there's plenty of, you know, flaxseed oil. There's ways that you can get that, you know, as well from food, as well as vegan supplements too. Turmeric, quercetin, and bromelain. And those last three, turmeric, quercetin, and bromelain, are also antioxidants, and that's the support that the lungs need. And that's going to help you during this time also, okay? When it comes to supplements, you don't necessarily have to be on these long term, right? Get your levels checked, know what you need. If you want to take something for support now, pick a few of them to support your body. You don't have to take the whole cupboard full, right? Okay, so antioxidant support, you want the right level of vitamin A, because vitamin A is also fat soluble like vitamin D. So you want to know your vitamin A, make sure you're taking the proper amount of that. Vitamin C is water soluble. That you can take preventatively. You can also take, vitamin C is good to have on hand, because if you start feeling sick, every 2 hours, take a dose of vitamin C, up to something that we call bowel tolerance. If you start having loose stools, that means that you've hit your amount of vitamin C that you need. Okay, it's water soluble, so it's not it's dangerous to take too much of it, as is a fat soluble vitamin. Okay, vitamin E is also fat soluble. So A, D, E, and K are all these fat soluble vitamins. You don't want to be taking too much of it, but the vitamin E and their mixed tocopherols is what you want to be taking, is a powerful antioxidant, supports you. Selenium, which I love, you can just take from Brazil nuts, okay? Pop one of these a day, 1 to 2, and you get your daily dose of selenium. It's wonderful. Okay. All right, and botanical herbs. So you want to think of ones that are, so expectorant botanical herbs, so ones that are soothing and relaxing. If you've got a crazy cough and you want to decrease the cough, you've got dry mucus, you want to thin out the mucus, soothing and relaxing ones will do it. On my PowerPoint here, I've listed a whole bunch of them. Or do you need a stimulating expectorant? Where you want to, you're trying to get excess phlegm up, you want a productive cough to get it out, and you want to get the secretions out of the body, then you're thinking more stimulating. If you take something that's called a tonic expectorant herbs, it's a combination of both of them, meaning that you take this herb and it can either have the soothing and relaxing effect on you, or it could be stimulating and produce that cough to get what you want out of your body out of it. Okay. There's also a beautiful herb called linguisticum or osha. It's antibacterial, it's antiviral. It's great for bronchial infections, great for a sore throat. Or something called lungwort, great for a cough or a cold. Okay. And the mind-body connections. So this is really an interesting one to talk about. When it comes to our emotions, so grief is the emotion of the lungs when they're out of balance. And I love referring to the Chinese medicine clock with this, because if you're waking from a slumber between 3 to 5 a.m., there's a circadian rhythm with the Chinese medicine clock, and each organ system has a 2-hour time frame when they shine, when they do their thing. If there's dysfunction in the body, then it actually, you don't feel that great during that time. So between 3 to 5 a.m., you might realize that you're waking up. So and this is something to think about. So when it comes to grief, it might be something apparent, like you lost a loved one, a pet, you're experiencing loss, or it could be something like a loss of job, where you're grieving what you used to be doing. So think about now what's going on. And this actually happened to me. When this whole thing was happening, I was waking up at these crazy hours. Mine was about 4 a.m. And I realized I was kind of mourning my life. I miss going to the office. I miss seeing my patients. I miss seeing all my coworkers. I'm a social person. So that extroverted part of me, I was missing that. And that's how it was settling in with me. So now I think I've kind of calmed down into everything. I'm still connecting with people. I'm, doing things like these webinars, which I love. So that kind of balanced out for me. So think about if you're experiencing grief, and how to tap into that. And there's tons of ways, there's tons of people out there. If you want any referrals to anyone, I just did, something called EFT tapping, the emotional freedom technique. My dear friend, who's great in it, Diane Gordon, she does it. And I highly recommend anyone in Long Island to go and see her, because it's amazing to do. She's doing the virtual ones now as well. And there's all these ways of dealing with grief. I have the emotional guidance scale that I work with my patients in, just talking about emotions and bringing light to them and seeing how it settles with each body, because, everyone has a different experience with their emotions, and it does affect your health. So if there's something that you're thinking about, something, that's affecting you emotionally or mentally, and you need to have an outlet for it, finding someone of a healer who can help you with that can be very effective. Acupuncture can be very effective too. So if you don't even want to talk about it, because sometimes it's too tough to talk about, or you're feeling emotions and you don't even know how to express it, acupuncture can be very effective as well. I look at the tongue and the pulse. Someone might be telling me one thing. I see their tongue and the pulse. I know that a certain organ's affected, and that I need to support that. They don't need to tell me anything. I can tell by the tongue and the pulse, and they feel better after the treatment. So it's pretty wonderful. I love how that works. Self-talk. So this is when I do my talk in the Salt Cave. I've been doing a self-talk series and bringing about, thinking about self-talk, and what is your self-talk? Is it positive or is it negative? Even understanding what the self-talk is, because the thoughts come before the feelings. It's like a knee-jerk reaction. We keep thinking that we have all these feelings, but actually we have these thoughts that come first, and then the feelings happen. And then we have all these feelings, and then we don't know how to deal with them. But if you roll it back and you think about what the talk is, the things that you tell yourself, it might even be an image that keeps going on in your head. And it might be something that's so common to you, a message or a phrase that maybe someone said to you when you were a kid, and you still believe it, and it keeps, saying it to you. Or maybe it was a kid on the playground that said something nasty in kindergarten, and you're still thinking about it now. We're humans, we're complicated. These things happen. We get affected in certain ways, and we cope with them and deal with them in the moment. If they get suppressed, and if we don't deal with them, then eventually at some point in our lives, they come out, we have to deal with them. Naturopathic medicine is wonderful at not suppressing, but yet dealing with it and allowing you to heal in all those ways. So other things that I like to use in supporting my patients with grief, Bach remedies are beautiful to use. So there are these lozenges. You can actually pick them up in CVS or Walgreens. In my office, I make custom supplements with these Bach remedies that are beautiful, and people really do love them. And then there's homeopathy. So homeopathy is not just for the mental emotional level. Homeopathy works on the physical level also. And I love that I saved it the best for last, because homeopathy is so extremely effective. There are so many remedies. So I encourage you, if you are into homeopathic remedies, homeopathy, if you've heard about it before, or even if you're just interested about it, find a doctor near you who has been trained in using homeopathy, because it can be very effective. And when you get the proper prescription for a specific remedy, it really can open the gateways for healing. It really is powerful, beautiful medicine when used properly. So it really can help on all those different ways for you. And then daily affirmations. So if I book, it's a little further over there. Louise Hay wrote this book, Heal Your Body. My dear friend, Dr. Kathleen Cannon, she shared it with me. I've been using it ever since clinic. It's beautiful. I end up now making my own daily affirmations for patients. It's a phrase that you can say to empower yourself, to feel better, to get you through your healing, journey, because this is a healing journey. So finding balance in the body is not, it's not a simple task, but it's not necessarily a difficult task. But you need guidance, and you need time, and you need to be easy on yourself. And I encourage you to try to explore naturopathic medicine. And if these daily affirmations can help my patients, I always like to use them to help. So if anyone's curious about them, I can even send you one for today. But so for today, I saved one here. So this is all of my information. Feel free to follow me on Instagram, drdawnnd, or on my Facebook professional page. Which is also /drdawnd. You can also email me. I work at Inner Source Health, which is in Huntington, New York, as well as Manhattan, New York. Right now, I'm doing virtual telehealth appointments. My email is drdawn@innersourcehealth.com. You can also reach out to me if you want a free 10-minute consult. I am happy to talk to you more about naturopathic medicine if it's right for you. You can just call the office or email me, and I'm happy to put you on the schedule and have a quick chat with you. And our website is innersourcehealth.com. So you can find out more information about myself and the other doctors that I work with there. We're really a wonderful team that we support each other, we support you, and we love our medicine because it does work. So I love this little phrase. Deep breaths are like little love notes to your body. All right, so just a nice, gentle reminder to take your deep breaths because it really does help support your lung chi. It helps support you. And I can't stress enough how important it is to do nice, deep breaths into the belly breaths. So I appreciate all everyone showing me some love on Instagram and Facebook here on the webinar. So I love it. So anyone who still has time, I've gone a little long here. It's about 1:40, but let's see. So the webinar is going to be posted on our YouTube channel. You can subscribe to us at Inner Source Health. All the past webinars are on there, as well as this current one is going to be on there. Milk for 2-year-olds. So the plant milks that I was talking about. So my little nephew, he loves oat milk and almond milk. Cashew milk. Excuse me. I get so excited about my nut milks there. So there's a whole bunch of them. So I encourage you to look for them. Be careful when shopping for the plant milks because some of them can be full of sugar. I like the unsweetened kinds personally. Add some cinnamon into it, into your coffee or tea if you want. For a 2-year-old, they're not doing the coffee. They might be doing the tea, who knows? But I love those nut milks. Make sure that they don't have something called carrageenan in it. It's a thickening agent and it's linked to cancer. Don't want carrageenan. So oil in general, so someone asked me what's the deal with olive oil. So oil, think about oil. Think about an olive and then think about olive oil. Okay, so someone who's trying to lose weight, you definitely just don't want oil because there's not much nutrition in it. Okay, and it's just dense calories. So when thinking about what exactly you're asking for, what you want in your life, oil might not be a first choice of a nutritious food. But there may be the good fats in there, you know, and all that you're looking for. But when you have the food, then you have all the fiber in it. An oil is an extraction of that's just what it is, the oil. So now you're missing out the fiber, you're missing out the antioxidants, all the nutrition from the food. And with the oil, then you're going to be hungrier because you don't have the fiber. You don't have all the nutrition in there. So it's just kind of an empty calorie that you're putting on things. So definitely not a huge fan of oil, especially when it comes to weight loss or anything like that. That's my deal with oil. If you want to ask any more questions regarding that, you can let me know. Some funny things. Yeah, so any inflammatory lung disease, what I was saying here can most definitely apply to it. So reversing that inflammation and you can really feel better, okay? Yeah, sorry, here's someone talking about. So everything I've talked about, I hope that some of these questions I've kind of answered in here, talking about some future concerns with lung disease because other family members have asthma, COPD, Crohn. Yeah, so what I was talking about, when you have chronic illness, it opens the gateway for other chronic illness. It's the way that it goes, right? When you have imbalance in the body, now you can have imbalance in a lot of ways. So, you know, with my personal condition, you know, I'll kind of share this with you. I had an autoimmune condition, I had lupus, and then that was the first diagnosis that I got. And right before I got that diagnosis, I also had IBS, and I was like, what's going on with me? Like, I'm just having all these things happen. And, you know, you get the comment, people go, oh, you're getting older. Like, no, it's not okay, because I had extreme fatigue. You know, I wasn't feeling well. So, but then I was able to reverse that, and I got my life back. Okay. So, you know, digestion came back. I didn't have that extreme fatigue. I didn't have the joint pain. I felt better. Then I had mild obstructive lung disease, which was probably also lurking, you know, that was going on. And, you know, something interesting with me is that you can be too sick to get sick, you know. So think about when kids, you know, there's the yang balls, you know, and they get these fevers, and they're doing that. They're building their immune system. So a healthy child, they will spike a fever, but, you know, they recover after a day or two. That's a healthy response. Okay. You get sick to feel better. I didn't notice my lung condition until after I'd reversed the autoimmune condition, and then this presented itself. Because why? I was healthy enough to even go on the incline on the treadmill to do that. It's pretty interesting, right? And then that presented to myself, and I was able to reverse it. So I did, in fact, reverse. I had mild obstructive lung disease. It can't hurt. Someone's asking me this question. Go to your pulmonologist when this is all said and done. Get a pulmonary function test. Find out your lung functioning. If you're concerned with any digestive issues, Crohn's, get inflammatory markers checked. You can get tested for that. And naturopathic doctors do all of that. When it comes to pulmonary function tests, for the most part, go to a pulmonologist for that. They've been trained in that. I don't know of any naturopathic doctor who does. If you are a naturopathic doctor out there and you do pulmonary function testing, just let me know. Happy to share your information and happy to talk to you too. Yeah, monk fruit. I love monk fruit. Okay. Yeah. If you're someone who eats honey, Manuka honey is a powerful antibacterial. Honey is very good as that soothing expectorant, right? It calms down the cough. It coats the tongue. Manuka honey is also antibacterial. You can use that. Monk fruit extract is really a nice natural sweetener. I love that too. Okay. Everyone's saying all these. Yeah. The Himalayan sea salts. I love that. Wet sock treatment. Yes. And there's a lot of details with the wet sock treatment. There's more to it, and I'm happy to share my handout for it. I've been doing it for years, and I love the wet sock treatment, and everything that I said in that was in fact correct. I know I can't make that other window larger there. Yeah, so just email me. If this is Kelly, just send me an email. If you want the link for that lung exercise, please send that to me, and I'm happy to get that to you. So yeah, so I think I got to everyone's questions. If I didn't, feel free to shoot me an email, shoot me a message. Happy to hear from you, and thank you for joining. Bye now.